Уважаемые коллеги,
Dear colleagues, we are beginning the session of the Dissertation Council for the defense of the dissertation by Galina Karaseva. The dissertation is submitted in conformity with the requirements for the academic degree of the candidate of medical sciences. The topic of the dissertation is the role of ultra-sensitive method of exhale air analysis in the disease diagnosis of upper gastrointestinal tract. Under the order issued by the Academic Secretary of St. Petersburg State University, Professor Alexander Gnotov, number 156/1, I, Professor Sergei Mazurenko, Doctor of Medical Sciences, St. Petersburg State University, have been appointed the chairperson of this Dissertation Council. The other members of the Dissertation Council have been appointed by the same order. They are Professor Natalia Bubnova, Doctor of Medical Sciences, Professor of the Department of General Surgery, St. Petersburg State University, Professor Alexander Rumyantsov, Doctor of Medical Sciences, St. Petersburg State University, Professor Marina Baluzek, Doctor of Medical Sciences, St. Petersburg Clinical Hospital of the Russian Academy of Science, Professor Anatoly Kucher, Doctor of Medical Sciences, Professor of Pavlov St. Petersburg State Medical Academy, and Professor Valery Miniev, Doctor of Medical Sciences, Professor of Pavlov St. Petersburg Medical Academy. Some members of the Dissertation Council are participating in this session remotely. They are Professor Viktor Kashenko, Doctor of Medical Sciences, St. Petersburg State University. Professor Kashenko, can you hear us and see us? Yes, I can hear you and see you. Professor Yuri Vinnik, Doctor of Medical Sciences, Krasnoyarsk State Medical University. Can you hear us and see us? Yes, I can hear you and see you. Professor Alexander Glukhov, Doctor of Medical Sciences, Burdenko State Medical University of the city of Voronezh. Can you hear us and see us? Yes, I can hear you and see you. And Professor Alexander Vorobey, Doctor of Medical Sciences, Belarusian Medical Academy of Postgraduate Education. Unfortunately, he is absent for a good reason. The academic advisors are also here. They are Professor Shishkin, Doctor of Medical Sciences, Professor of St. Petersburg State University, and Professor Varzin, Doctor of Medical Sciences, Professor of St. Petersburg State University. I would like to ask the members of the Dissertation Council who are participating in the session online to switch off their microphones. Please make sure that your microphone is switched on when you are given the floor. This session of the Dissertation Council is being recorded and broadcast on the official website of St. Petersburg State University, and it is being interpreted into English. You can ask questions and make comments about the dissertation using the email address that you can find on the official website of St. Petersburg State University. This will allow you to participate in the academic discussion. The technical personnel will refer the questions to me, and I will read them out during the discussion. The questions are supposed to be relevant to the contents of the dissertation. The authors of the questions are to write down their name, position, and workplace. The questions that are not relevant to the contents of the dissertation or anonymous questions will not be read out. Under the order on the procedure of granting academic degrees at St. Petersburg State University, issued by St. Petersburg State University, this session of the Dissertation Council is duly constituted, provided at least 2/3 of the members of the Dissertation Council are present. The total number is not to be fewer than 4 people. This Dissertation Council consists of 10 people, 9 of which are present, including 2 members of the Dissertation Council who are participating in the session online. Therefore, we have a quorum. I would like to ask the members, or rather would like to ask the representative of the Department for Dissertation Council Management to make an attendance list. The agenda of the session is as follows. The session will last for about 2 hours. The chairman's presentation about the documents submitted by the academic degree seeker and their conformity with the requirements. Chairman's reply to questions, if any. The degree seeker's presentation, providing an overview and findings of the research, 15 minutes. Questions to the academic degree seeker about the presentation, no more than 2 minutes for each question. Reply to the questions. Reports on the dissertation. The council members will be taking the floor in turns. About 10 minutes per person. The chairman's report on the dissertation, about 10 minutes. The academic degree seeker's comments about the reports on the dissertation and replies to the questions, no more than 20 minutes. Open discussion. The floor will be given to the members of the audience. They can give a brief account of their ideas or ask questions about the research. No more than 2 minutes per person. It is necessary to fill in the registration form and give their full name before the talk. Next, the chairperson will read out the questions received via email. Please note that questions which take more than 2 minutes to read will not be read out. Next, replies to the questions. Next, presentation of the dissertation supervisor, no more than 3 minutes. Deliberations of the members of the Dissertation Council before the open balloting on conferring or non-conferring the academic degree. The discussion of the results of the defense is not broadcast. Open balloting, vote counting and recording the results in the protocol. Making a decision on whether to confer or not to confer the academic degree. The academic degree seeker's closing speech. Dear colleagues, do you have any questions or objections to the agenda? Since there are no objections, I would like to proceed with the agenda. First of all, I would like to ask you to leave your telephones set on silent mode. The council members which are participating in the session online are kindly asked not to switch off their mobile phones so that we can contact you in case of a technical failure. Now I will proceed with the agenda. The chairman's brief presentation. The dissertation by Galina Karaseva is submitted in conformity with the requirements for the academic degree of the candidate of medical sciences. The specializations are 3118 internal illnesses, 319 surgery. The topic of the dissertation is the role of ultrasensitive method of exhale air analysis in disease diagnosis of upper gastrointestinal tract. The dissertation was approved for the defense by the appropriate order issued by the Academic Secretary of St. Petersburg State University. The dissertation was completed in St. Petersburg State University. The research advisors are Professor Alexander Shishkin, Doctor of Medical Sciences, and Sergei Varzin, Professor Sergei Varzin, Doctor of Medical Sciences. The degree seeker has published 3 research papers. They have been published in peer-reviewed journals recommended by the Ministry of Education and Science. She hasn't published any papers in journals which are indexed by Web of Science or Scopus. The degree seeker has submitted a full set of documents to the Academic Secretary of St. Petersburg State University. The documents are in compliance with item 12 of section 3 of the order. The documents comply with the major requirements for such documents, and the representative of the Department for Dissertation Council Management has the copies of the dissertation, or has the copies of the documents. Before giving the floor to the academic degree seeker, I would like to ask the members of the Dissertation Council if they have any questions to the academic degree seeker, and if it is necessary to read out the list of documents. So, do you have any questions? So, I give the floor to Ms. Karaseva. Dear members of the Dissertation Council, dear colleagues, the topic of my dissertation is the role of ultrasensitive method of exhale air analysis in disease diagnosis of upper gastrointestinal tract. High mortality and morbidity rate in patients with acid-related diseases and tumors in upper gastrointestinal tract show that it is necessary to develop simple diagnostic methods which can be used for screening, and exhale air analysis is a promising method. The purpose of our dissertation was to develop and to apply in clinical practice a method for diagnosing disease of the upper gastrointestinal tract, a method which is based on using highly sensitive analyzer for determining the gas composition of the patient's exhaled air. The objectives of the dissertation are as follows: to evaluate the capabilities of the method of the gas composition of exhaled air analysis, and define factors criteria for healthy subjects and patients with diseases of the upper gastrointestinal tract, to identify differences in the gas composition of exhaled air in patients with pathologies of the stomach and duodenum, and to determine the ability of Helicobacter pylori infection to influence its composition, to determine the significance of the indicator of the gas composition of exhaled air using a food load test, to elaborate a methodological approach for screening diagnostics of the disease by analyzing the gas composition of exhaled air. Provisions brought for defense are as follows. The gas composition of exhaled air has significant differences in healthy patients with diseases of the upper gastrointestinal tract of therapeutic and surgical profiles. Gas analysis of exhaled air of patients with diseases of the upper gastrointestinal tract reveals a close dependence with Helicobacter pylori infection. The use of the method of gas analysis of exhaled air with a food test load allows for differential diagnosis of stomach disease. The research included 216 people. 84 people were healthy people, and 132 were patients from Pokrovskaya City Hospital and from the Polyclinical Department number 4. Group number 1 included male between 17 and 21, and the test group included men and women aged between 25 and 85. Group number 1 undergoes an annual medical examination, and we conducted clinical tests and investigations for group number 2, such as full blood count, urine analysis, and different instrumental methods such as EGE, ultrasound, biopsy, and so on. We also conducted different types of tests to identify Helicobacter pylori in both groups. We focused on identifying the main components of the exhaled air. The analysis of gas composition was conducted for 216 people. We also conducted a load test food with the help of 40% solution of glucose for 30 patients. The volume was 20 milliliter. We also made statistical analysis of the data. To analyze the gas composition of the exhaled air, we used multi-sense gas analyzer. This gas analyzer included the sampling device, a ventilator, and sensors which have cross sensitivity for saturated hydrocarbons, volatile fatty acids, and impurities. The sampling was done with the automatic aspiration from the oral cavity with the help of a pump. The velocity was between 0.3 and 0.5 liters per minute. Then all the readings were recorded. When conducting the experiment, we took into account the composition of the environment air. The instrument has been calibrated by the cold vapor method from solutions of volatile fatty acids. This was a 4-stage research. The first stage included the development of the measurement techniques and determination of the parameters of gas composition of the exhaled air. This was done for group number 1, the group of healthy people. At the second stage, a complete clinical examination and study of the gas composition of exhaled air was carried out in the main group of patients, group number 2. At the third stage, we developed a load food test to increase the specificity of the test. And at the fourth stage, we developed an algorithm for screening. We identified the gas composition of exhaled air for groups number 1 and number 2. The research outcomes showed that that patients from group number 2 could be divided into 4 groups: acid-dependent diseases of the stomach and duodenum, gastric neoplasia, pancreaticobiliary disease, and disease of the oral cavity. And you can see the appropriate graph on the slide. We assessed the results according to specific census, and we also used the Mahalanobis distance, which allows to determine the similarity between the unknown and known sampling. Therefore, we were able to identify a group of healthy patients and a group of patients with the oral cavity diseases. We also conducted breath test for Helicobacter pylori for 15 people. For patients of the second group, we also conducted a morphological research for gastrobiopaths in order to identify Helicobacter pylori, and we identified it in 52 people. Then we compared the gas composition of exhaled air for HP positive and HP negative patients with stomach neoplasia. Patients without stomach neoplasia, but those who had HP infection, had statistically significant census. We also used statistical analysis in our research. We used discriminative analysis based on the classification tree. This method allowed us to differentiate between healthy patients and other patients. We received the integral threshold coefficient, which equals to 65 conventional logarithmic units. If this coefficient was below 65, then the person was regarded as a healthy one. If it was above, then it was regarded to be a person with a pathology. We also received an integral coefficient for patients from the second group. It equaled to 115 conventional logarithmic units. If the coefficient was above 115, then the patient was regarded as a patient with oral cavity diseases, which allowed us to put such patients into a separate group. However, the predicative value was just 30%, therefore it was quite we couldn't differentiate this group with certainty. Gas analysis is important for preliminary screening for patients who are at risk of stomach diseases. This screening allows us to refer patients for further tests and analysis. Moreover, gas analysis allows us to identify patients with dyspepsia, and therefore we can avoid endoscopic invasion. We also compared gas analysis for 3 sensors and Mahalanobis distance. There were some specifics in the gas spectra, however, they did not allow us to identify patients with gastrointestinal tract diseases and stomach neoplasias. The statistical analysis allowed us to calculate the threshold levels for census and Mahalanobis distance. The results were as follows. If 1 or 2 indicators were higher, then the risk of stomach neoplasia increased up to 68%. If 3 or 4 indicators were abnormal, then the risk of neoplasia increased by 22 times. In order to identify the patients in this group, we also had to conduct a load test. The third stage of our research was the development of the load test. We used 20 milliliter of 40% glucose per os. Then we compared the results with the sensor 2 readings, and this allowed us to identify stomach neoplasia. According to Warburg theory, mitotic division of cancer cells require energy, which is released during breakout of glucose. Glucose is the only hydrocarbon which is hydrolyzed by Helicobacter pylori. Moreover, it is easy to produce, and 20% is a physiologically acceptable dose. So the results were as follows. The peak readings of the C2 sensor were at the 15 and at the 30th minute. Here you can see the graphs that we developed. Here you can see the delta value. If delta was higher or equal to 10 units, it meant that the patient was at risk of stomach neoplasia. Besides, we also received the following results. We were able to identify and divide the patients into different groups and identify patients with stomach neoplasia. We also used Fisher's angular transformation, which was 96%. This is the algorithm of our research. Screening of patients, which included sampling and measurements of the gas composition of exhaled air, then IT analysis of the sensors and other parameters, then identification of patients using the threshold levels of sensor readings, and then we identify the group of patients which should be referred to further tests and analysis. The research findings are as follows. The method of gas analysis of exhaled air is effective for separating healthy people and patients with pathology of the upper gastrointestinal tract. The gas analysis of exhaled air in patients with acid-dependent diseases of the upper gastrointestinal tract reveals differences between patients positive and negative on Helicobacter pylori infection. The use of the method of gas analysis of exhaled air in patients with acid-dependent diseases makes it possible to identify risk groups for neoplasia of the stomach. The risk of their occurrence increases multiple times when the threshold readings of sensors are exceeded. A safe method of test food loading with 40% glucose solution has been developed, which is effective for the studied marker gases. It significantly increases the specificity and sensitivity of the method of gas analysis. Practical guidelines. The study of the gas composition of exhaled air should be carried out as a screening examination of the population to identify patients with diseases of the upper digestive tract, including those occurring covertly. The results of the gas analysis allowed us to identify patients whose threshold values of sensors exceeded the normal. If the threshold values of the sensors are exceeded, it is necessary to conduct a food load test, followed by the determination of signal gases markers of exhaled air in the proposed time intervals at 15 and 30 minutes for differential diagnosis of stomach diseases. Gas analysis of exhaled air should be used in medical institutions to identify risk groups for stomach diseases. This will increase the number of patients who should undergo EGDS with morphological examination of biopsies, including for the presence of Helicobacter pylori infection if atrophy metaplasia or dysplasia of the gastric mucosa associated with HP infection. Gastric neoplasia is detected on EGDS. Patients are referred to a specialized doctor. Dear members of the Dissertation Council, are there any questions to the academic degree seeker? I have a question. Is this method used to diagnose other diseases, for example, for bowel diseases? I didn't include such patients in the group. Yes, I know. I'm asking about literature because I haven't found any information about the use of this method for other diseases. Other methods are normally used if we talk about patients with bowels. We use released gases, not exhaled gases. I would like to ask another question about this gas analyzer, Multisense. Is it locally produced or is it produced abroad? Where is it produced and where else is it used? How much does it cost and what are its capabilities? Thank you very much for your question. This gas analyzer is produced domestically. It is produced by the AMA company, which is located in St. Petersburg. This gas analyzer was developed by physicists and also by university professors. Other scholars have written dissertations about the use of this multisense, for example, for patients with chronic tonsillitis and with tumors. Are there any other questions? I would like to say that I liked your presentation. I liked that it was very logically, the information was logically presented. So you had two groups, the control group and the test group. However, they were different in terms of their age. Do you think that age has an influence on the exhaled gas composition, and did you take this into account in your research? Unfortunately, it was difficult to find a group of healthy young women, such women who undergo examination every year. So why did I choose males for the control group? These students of the military academy, of the naval academy, undergo a medical examination twice a year, and they did not have any complaints. So they were practically healthy people. Yes, I understand, but I'm asking you about the age characteristics. Did you take into account the age? Probably you should have taken into account the age characteristics of each group. The patients of the first group were aged between 17 and 21 years old, and patients of the test group were aged between 25 and 85. So they were young people as well. However, they were included in the group of patients with the oral cavity diseases. I understand your question, but we didn't conduct any other types of research. Now, next question. I would like to say that I liked your presentation. It's so interesting. I have known you for a long time and I have a few questions. You make your list of reference includes 152 foreign sources. In what other countries is this method used? That's the first question. Thank you very much for your question. This method is used. However, they use other devices, and these devices have different senses. So this method is used in Israel, in Italy, but it is mostly used for lung diseases. My next question is as follows. Who can I refer my patient to, and how much will it cost? How is it implemented in practice? Thank you very much for your question. When I was doing my research, we were hoping that we would be able to test our methods in hospitals, but there were many challenges. Unfortunately, in our country, only devices which are produced in other countries can be used in our hospitals. However, this device has some components which are produced in Germany. We were planning to produce this device in Finland, but we were not able to do this. So I cannot refer this patient to anyone. No, but I hope that my dissertation will give a boost. How much can such research cost? What do you think? The research itself is not difficult. The test itself can be done by nurses and by people who are not medical doctors. You just train the operators, you train them how to sample the air, how to do the air sampling, and then the software does the calculations. And you can make tests for 50 patients per day using our device. And the results will be ready on the next day. And I have another question. Are oncologists familiar with your research? If yes, then what is their opinion about your research? No, they're not familiar with my research. Are there any other questions? I would like to ask you about the following thing. Do you think doctors or general practitioners should have such devices? Yes, I think we should do so, because this device allows us to identify patients which should be referred to further tests and analysis, even if they do not have any symptoms or complaints. Thank you. Okay, next question. I was listening. While I was listening to your presentation, a question arose. Can we use your method to identify the gas composition locally? For example, the gas composition above the skin surface. For example, for patients with different skin diseases. You know, skin releases different chemical elements. Thank you very much for your question. Yes, we can develop such a method, and we can collect air samples from any body parts. However, we have not done any research because nobody is interested at the moment. Well, this is probably a topic for your further research. We haven't received any external reports on the dissertation. Now let us move on to the next item on our agenda. All the reports are published on the official website of St. Petersburg State University. Therefore, I would like to ask the members of the Dissertation Council to be brief and to focus only on the most relevant parts of your dissertation and on the critical remarks. I hope the members of the Dissertation Council do not mind. Now let us proceed with the agenda. I give the floor to Natalia Bubnova. Thank you very much. Dear members of the Dissertation Council, dear colleagues, dear research advisors, and dear academic degree seeker. First of all, I would like to say that I really liked reading the research. A couple of decades ago, this was the best doctor who conducted endoscopy in our hospital. And then this dissertation came my way, and it was really interesting to read it, so thank you very much. The topic of the dissertation is really relevant because the problem of upper GI tract diseases is a relevant one, and this topic, this dissertation can be useful for general practitioners and for surgeons. Many patients have complications. I work in St. George Hospital, and I get patients daily with different complications, and many of them need further examination. So I suppose that your research is useful. In St. Petersburg alone, there are hundreds of patients with bleeding from ulcers, with perforative ulcers, and so on. We have such patients almost on a daily basis. So early diagnosis and template method is really important. And I suppose your method of analysis of exhaled gas composition is extremely important, and also it's also a promising method. So I'm the first one to talk. Therefore, I would like to focus on some other aspects of my report. So the dissertation has a traditional structure. The introduction talks about the relevance of the topic, about the purpose and objectives of the research. The research was done on 216 patients. 132 of them were undergoing treatment for abdominal pain with dyspepsia. What I would like to focus on here According to the dissertation, the presence of Helicobacter pylori changes the gas composition of exhaled air. There has been lots of debate about whether we should take into account the presence of Helicobacter or not, or no, but it turns out we should. The author of the dissertation has proven the main provisions brought for defense. Therefore, I would like to say the following. The dissertation is relevant, it has scientific novelty and theoretical and practical value. The research can be recommended for practical use and for practical implementation. I do not have any critical remarks for the dissertation. And the dissertation by Galina Karaseva, the role of ultrasensitive method of exhale air analysis in disease diagnosis of upper gastrointestinal tract, complies with the major requirements set forth in the relevant order of St. Petersburg State University. And Galina Karaseva can be awarded the academic degree of the candidate of medical sciences, scientific specialties 3118 internal diseases, 319 surgery. The dissertation is compliant with sections 9 and 11 of the above mentioned order. Thank you. Thank you very much. Now I give the floor to Viktor Kashenko. Professor Kashenko, can you hear us and see us? Dear colleagues, can you hear me? Yes, we can hear you. Dear members of the Dissertation Council, dear Chairperson, dear colleagues, I would like to read out my report on the dissertation. I must say that I would like to focus only on the most relevant parts of the report. I am not going to retell the contents of the dissertation and talk about its structure. The dissertation deals with diagnostics. Therefore, I would like to say a few words about the diagnostics. I suppose there have been mixed reactions to the dissertation among the surgeons. And the point of view depends on the definition of diagnostics. So probably if we define diagnostics as determining the diagnosis, then different types of tests and investigations are useful. And here we talk about different types of laboratory tests and instrumental tests. However, diagnosis can be also regarded from a different angle. We can talk about diagnosis when we talk about the essence of the disease. And today we see the evolution in our attitude to diagnosis in general and to diagnosis in surgery. Today it is not enough for the surgeon to identify the etiological diagnosis such as ulcer, neoplasia, stomach cancer and so on. Today we need predicative parameters which will show us how the disease is progressing. Therefore, we need extra information which will tell us how the pathology is going to progress, how it is going to progress without any medical treatment and how it is going to progress with a treatment. So we need a prognosis about the course of the disease. Therefore, we see the evolution of diagnostic programs. For example, when it comes to oncological diseases, it is important to give a diagnosis, also to identify the stage of the disease. It is also important to conduct some mathematical modeling, some mathematical simulation. So I suppose that the analysis of exhale air gives us important predictive factors which can reveal the future course of the disease and the prognosis. Let's us imagine we are monitoring a patient after surgery. We need to conduct lots of tests and investigations, but if we have such a gas analyzer, then we have an easy way to get information about risks of developing, of adverse events developing. So this is a first step which will allow us to develop a monitoring system. Another thing I would like to focus on is that it's a screening test. We are tired of diagnosing disease with clinical presentations. How do we diagnose cancer? When do we see clinical presentations? If a patient does not have any symptoms, then we cannot prove that the patient needs colonoscopy, and the insurance company will not refer such a patient to the colonoscopy. However, this screening analysis will allow us to change our approach to the diagnosis. It's a very simple system, and we can conduct a total screening of the population. It will solve the problem of the national health care and different socially important problems. So this is a dissertation, but however the magnitude of the problem is much higher. So it's a very important research. It is a dissertation which defines the development of the surgery. It defines the surgical strategy in the future. So it's a revolutionary work, and it provides a new understanding of diagnostics in surgery. I don't have any major critical remarks about the dissertation. There are some inaccuracies in the dissertation, however, they do not change the overall positive assessment of the dissertation. However, I suppose you could have included a group of patients which underwent surgery, but this is probably a topic for your further research. I have a few questions that I would like to ask. So, my first question is as follows. Can we be sure that the group of health patients did not include any patients with with some covert diseases? So there was a group of military young people. We examined them and we decided that they were patients, but probably some of them were not that healthy. So how did you make sure that they were all healthy? The dissertation talks about the general methods of treatment and diagnostics. So my second question is, how do you understand surgical, the term surgical patients and therapeutic patients? How do you make a borderline between these groups of patients? many diseases and many conditions gradually lose the surgical component, and the diseases that were regarded as surgical diseases are not regarded so anymore. So where's the borderline between therapeutic patients and surgical patients? And can we monitor exhale air of patients after surgery in order to predict risks of complications? I think this would allow us to get follow-up information about patients after surgery. So the dissertation, the role of ultrasensitive method of exhale air analysis in disease diagnosis, complies with the major requirements set forth in order number 11181/1 as of the 19th of November 2021. And Galina Karaseva can be awarded the academic degree of the candidate of medical sciences, scientific specialties 319 surgery, and I'm not an expert in internal diseases, but the dissertation complies with 319 surgery. I would like to answer your questions. The first question was about the group of healthy patients and how did you make sure that they did not have any asymptomatic diseases. So they were students from the Naval Academy who undergo medical examination, thorough medical examination twice a year. And after that, they can be regarded as practically healthy. Moreover, they did not have any complaints when we were doing our research. Now about the surgical and therapeutic patients. Surgical patients are patients that were admitted to the surgical department, or those who came to hospital with abdominal pains. They required surgical consultation in order to rule out some diseases. Therapeutic patients are those who needed diagnosis or treatment about different conditions. You also asked me about the monitoring procedure. We normally have patients with comorbidities. We used 3 sensors which were sensitive for specific gas components. The exhaled gas contains more than 300 components, both of organic and non-organic matter. When it comes to monitoring of post-surgery patients, I suppose it is too early to talk about it right now. Maybe we should look into other pathologies. What we take inside, what we have nearby, and different types of medications that we take have an influence on the gas composition. Therefore, we need extra research here. However, I suppose we'll be able to do this in the future. We just need a group of patients who would like to participate in the research. Are you satisfied with the answers? Yes, I'm fully satisfied with the answers. Thank you. Now I give the floor to our next speaker. I give the floor to Professor Rumyantsev. Dear members of the Dissertation Council, dear colleagues, a lot has been said about the dissertation. I agree with my colleagues when it comes to the positive assessment of the dissertation. GI disorders is one of the main reasons for being admitted to hospitals. Therefore, it is necessary to conduct examination and diagnosis. And we need instrumental tests to diagnose GI diseases. However, instrumental tests are very expensive. I'm talking about biopsy and endoscopy. Therefore, the method that you are suggesting could be really effective. A colleague of mine has talked about therapeutic patients and surgical patients. I suppose surgeons are the elite of the medical community, and a patient should be referred to a surgeon only when they cannot be treated by a general practitioner. A surgeon is somebody who should perform surgeries. So the method developed by Ms. Karaseva changes the approach to diagnosis. So I suppose more patients will be referred to general practitioners. I have already asked some questions. So when we talk about screening, we talk about a patient who doesn't have any complaints. However, the screening allows us to identify that the patient has some diseases, and it's great that this is not endoscopy. This screening method does not require any injections or any invasive methods, so it does not change the lifestyle of the patient. Diagnostic methods of GI tract are varied, and Palpal test is used quite often. However, the method that you have developed allows us to talk about the nosology of the disease. I'm not going to talk about the structure of the dissertation, since the dissertation has a traditional structure. It is logically written. I suppose you should be more accurate you should have been more accurate with practical recommendations. Your practical recommendations are written in the form of an instruction, not in the form of guidelines. So, the dissertation by Galina Karaseva, the role of ultrasensitive method of exhale air analysis in disease diagnosis of upper gastrointestinal tract, complies with the major requirement set forth in the relevant order issued by St. Petersburg State University on the procedure of granting academic degrees at St. Petersburg State University. And Galina Karaseva can be awarded the academic degree of the Candidate of Medical Sciences, Scientific Specialty 3118 in Internal Illnesses and 319 Surgery. The dissertation is compliant with sections 9 and 11 of the above-mentioned order, and I don't have any critical remarks. Thank you very much. Now I give the floor to Professor Baluzek. Dear members of the Dissertation Council, I suppose each consecutive member of the Academic Council should say fewer words than the previous one. However, I would like to say that now we are implementing the national project which is designed to combat oncological diseases, and screening methods are important for fighting oncological diseases. They're important for identifying such common pathologies as tumors of GI tract. The academic degree seeker has reached the goal of the dissertation. She has developed a screening method and she has implemented this screening method. It also includes the diagnosis of neoplasia, which is quite important in the light of the project I've mentioned above. This screening method has high sensitivity and high efficiency. I suppose it's a universal method. My colleagues asked questions about the possible use of this analyzer for diagnosing different diseases. Besides, let me remind you that this method was developed here in St. Petersburg on St. Basil's Isle. And I suppose we can implement this within the framework of import phase out. I would like to say that in the future you should take into account the age distribution as well. You have mentioned yourself that your patients are patients with comorbidities. Therefore, I suppose the morbidity has an impact on the gas composition as well. And I wish you every success in your research. The dissertation by Galina Karaseva, the role of ultrasensitive method of exhale air analysis in disease diagnosis of upper gastrointestinal tract, complies with the major requirements of the relevant order issued by St. Petersburg State University, and Galina Karaseva can be awarded the academic degree of the candidate of medical sciences, scientific specialties 3118 internal diseases and 319 surgery. Although I am not a surgeon, the dissertation is compliant with sections 9 and 11 of the above mentioned order. I give the floor to Professor Vinik, dear Chairperson, dear members of the Dissertation Council, dear colleagues. Gastrointestinal tract disorders is a challenge for surgeons and general practitioners. About 2,000 people die of such diseases in Russia annually, or rather 200,000 people. GI disorders have a specific clinical presentation. However, sometimes they are asymptomatic. Therefore, the screening for timely diagnosis is important. The dissertation is designed to develop the screening method to diagnose upper GI tract diseases. So this is a very topical dissertation, and it is important for clinical practice. The dissertation is well written. The purpose and the objectives of the dissertation are well formulated. The dissertation also draws upon the analysis of scholarly works and on her own practical experience. The academic degree seeker used the gas analyzer in her research, and the research included 3 stages. She identified the differences in the gas composition of healthy patients and patients from the test group. She also found methods to increase the predictive value of the analysis. So she developed a food load test, which includes a 40% glucose solution, and this load test was patented. The research findings are valid and credible, and the research findings are in line with the purpose and objectives of the dissertation. She also writes about the practical guidelines. The academic degree seeker has published 15 papers, and 3 of them have been published in the journals recommended by the Ministry of Education of the Russian Federation. I do not have any critical remarks. So, the dissertation by Galina Karaseva, The Role of Ultrasensitive Method of Exhale air Analysis in Disease Diagnosis of Upper Gastrointestinal Tract, complies with the major requirements set forth in the relevant order issued by St. Petersburg State University on the procedure of granting academic degrees at St. Petersburg State University, and Galina Karaseva can be awarded the academic degree of the candidate of medical sciences. Scientific specialties are 3118 internal illnesses, 319 surgery. Thank you. I give the floor to our next speaker. So the floor is given to Professor Glukhov. Thank you very much. Dear Chairperson, dear members of the Dissertation Council, dear colleagues, I would like to say that I agree with what has been said before. The topic of the dissertation is relevant. The problem she's talking about is relevant. We know how many patients die of the diseases in question. And there is only one way to solve this problem, which is to provide early diagnosis. Sometimes early diagnosis is associated with oncological diseases. However, we shouldn't forget that non-oncological diseases also pose a major problem and have a high death rate. We have different diagnosis methods. We have different diagnostic methods which allow us to identify disease at an early stage. But the problem is that it is difficult to organize mass diagnosis, is to organize mass screening. Such mass screenings allow to suspect that the patient has a specific disease. In view of the above said, the method developed in the dissertation is really an important method for early diagnosis. So, if we make a feasibility study, take into consider the logistics and develop the practical aspect of the work, then I suppose that this method can be used for medical purposes as well as non-medical purposes. I really liked how the dissertation is structured. She formulates the purpose and objectives of the dissertation. I also liked her statistics analysis of the data. The statistic analysis increases the credibility of her research findings. The design of her research is also quite complicated. Moreover, the dissertation has scientific novelty, and the academic degree seeker has obtained a patent. She has achieved the goal of her dissertation. The research findings are in line with the objectives of the dissertation, and she has developed practical recommendations. The dissertation is well written. It has illustrations, and the research findings have been discussed at different conferences, including Russian conferences and international conferences. I do not have any major critical remarks about the dissertation. However, I would like to say that probably you should have focused on the fact that you have developed a new methodological approach to screening. You have developed a new approach to screening diagnosis of upper GI disorders. So the dissertation by Galina Karaseva, the role of ultrasensitive method of exhale-A analysis in disease diagnosis of upper gastrointestinal tract, complies with the major requirements set forth in the relevant order of St. Petersburg State University on the procedure of granting academic degrees at St. Petersburg State University. And Galina Karaseva can be awarded the academic degree of the candidate of medical sciences. Scientific specialties 3118 internal illnesses, 319 surgery. The dissertation is compliant with sections 9 and 11 of the above mentioned order. Thank you. Now I give the floor to Professor Kucher. Dear members of the Dissertation Council, dear research advisor, dear colleagues, thank you for inviting me to the session of the Dissertation Council. I would like to say that I didn't like your dissertation at the outset. At first, I was thinking about the necessity of some new diagnostic test for surgeons and general practitioners, because we already have some tests. However, when I reread your dissertation, I realized that it has many advantages. Well, the dissertation talks about the screening. It's not a secret that many patients don't like invasive tests. And the existing diagnostic methods also have drawbacks. Some hospitals are not equipped and some doctors are not qualified to conduct such tests. Therefore, I suppose the topic of the dissertation is relevant. You have found an original method. I suppose that we can there's always a way to improve diagnostics, and your screening method is one of them. I would like to talk about the positive and negative aspects of the dissertation. On the positive side, the design of the research is superb. It is really well written. Besides, I would like to say that I really appreciate the statistical analysis. I was really impressed by the statistical analysis. It's a big advantage of the dissertation. And another big plus is that the dissertation is based on the Russian device, on the device which is manufactured in Russia. I'm not going to read out my report from beginning to end. However, the dissertation also has some drawbacks. You analyze lots of literature. However, I would like to ask you about recent papers. Besides, your papers were written about 10 or 12 years ago, so I suppose you have been writing this dissertation for a very long time. So you have been working on this topic for quite a long time, and this is an advantage of this work. So the dissertation by Galina Karaseva, the role of ultrasensitive method of exhale air analysis in disease diagnosis of upper gastrointestinal tract, complies with the major requirements set forth in the relevant order issued by St. Petersburg State University on the procedure of granting academic degrees at St. Petersburg State University. And the academic degree seeker can be awarded the academic degree of the candidate of medical sciences. Scientific specialties 3118 internal diseases, 319 surgery. Thank you. Now I give the floor to Professor Mineev. Dear Chairperson, dear members of the Dissertation Council, I would like to say that this dissertation has a practical focus, and this is the main objective of the dissertation. The idea to use exhale air composition is not new. For example, this is used in pulmonology. Exhale air analysis is used to diagnose bronchial asthma. However, this test doesn't have high specificity, but science is developing and methods are developing. So this idea can be applied in gastroenterology, Moreover, I suppose this method can be applied to other in other specialties. For example, the magazine, the journal which is published by our university, produced an article which said that oncological patients had different body odors. Had specific body odor, and probably we can use gas analyzer to diagnose oncological diseases. We usually talk about the relevance of the topic when we write a report, and I suppose the topic is relevant until there is at least one patient. So if there is at least one patient, then the study of this patient is relevant. So of course the topic of the dissertation is relevant. I have been thinking about this for a long time. So I suppose it's not necessary to look for the relevance of the research, because we always have patients. I have some questions about the mechanisms of air sampling, and I suppose there is information about it in literature. I suppose the dissertation has practical significance. It is important that you can diagnose diseases in patients who don't have any complaints. When such gas analyzers are produced in Russia, I suppose you will have lots of patients who would like to undergo screening. So the dissertation by Galina Karaseva, the role of ultrasensitive method of exhale analysis in disease diagnosis of upper gastrointestinal tract, complies with the major requirements set forth in the relevant order issued by St. Petersburg State University on the procedure of granting academic degrees at St. Petersburg State University, and Galina Karaseva can be awarded the academic degree of the candidate of medical sciences. Thank you. Dear members of the Dissertation Council, now I would like to talk about the dissertation as well. I will start with the relevance of the report. We have our medicine, our healthcare focuses on preventive measures. Okay, I will sit down. I suppose that we shouldn't forget about classical approach, which includes physical examination and interview with the patient, but it takes time to get a consultation. The doctor is limited in time, and doctors have sometimes doctors don't have enough qualification. So I suppose the topic of your research is topical. Unfortunately, many GI tract disorders are diagnosed too late. The dissertation also has scientific novelty. Similar methods are used to diagnose different diseases. However, this is original research. It has a practical focus. The research findings of the dissertation are valid and credible. You have collected material. You also had a control group. The research findings are in line with the objectives of the dissertation. I do not have any major critical remarks. The statistical analysis is done at a very high level. So the dissertation, the role of ultrasensitive method of exhale air analysis in disease diagnosis of upper gastrointestinal tract complies with the major requirements set forth in the relevant order issued by St. Petersburg State University. And you should be awarded the academic degree of the candidate of medical sciences. Scientific specialties 3118, internal illnesses 319, surgery. I do not have any critical remarks. Does anybody have a question? There are no questions. Have we received any questions via email? No questions received via email. Now I would like to give the floor to the research advisors. So I give the floor to Professor Shishkin. Thank you very much for giving me the floor. We are really happy that you haven't forgot about the researcher advisors. I worked with Galina when I was a professor in one of the universities. Galina Karaseva was my student. Over the years, Galina Karaseva has become an exemplary doctor. I suppose my colleague will add something in this regard. However, I would like to say that it was a pleasure to work with her. We have been working over the past few years. Probably sometimes we were strict with her. We discussed the dissertation at our department several times. Besides, I would like to say that Galina is a very diligent researcher. She also has self-discipline. And it is always a pleasure when a practicing doctor focuses both on practical applications and on research. So that would be all. Thank you. Thank you very much. I give the floor to the other research advisor. I give the floor to Professor Varzin. Dear members of the Dissertation Council, dear colleagues, dear guests, dear Galina, we have been working with Galina Karaseva for some time. She's a doctor, she's a scientist, she's a mother. A few years ago, she decided to do scientific research. She has been doing her research together with specialists from other areas. The gas analyzer was developed and it was tested. Then they decided to conduct research using a group of patients. Galina Karaseva is an unusual person. She graduated from Leningrad Sanitary Medical University. Then she had residency, then she took a postgraduate course. She worked in inpatient hospitals, in St. George Hospital, in Pokrovsky City Hospital, and so on. So she had certificates which proves that she has in-depth knowledge of endoscopy, of internal diseases, and of surgery. She has been working as an endoscopist lately. And I would like to say that this is the result of our work. Thank you very much. Does anybody else want to say a few words about Galina Karaseva? Have we received any questions by email? No. So that is the end of the academic discussion. I would like to ask you the following question. Do you have any other questions? Since there are no questions, I would like to proceed with the agenda. I'm sorry. Are there any questions or any remarks about the procedure? Are there any questions, remarks about this session of the Dissertation Council? Natalia Alexeyevna, do you have any questions? Viktor Anatolievich, can you hear us? Do you have any remarks about this session, about the procedure? Marina Felixovna? No. Yuri Semyonovich, can you hear us? Yes, I can hear you. Do you have any remarks about the procedure? No. Alexander Anatolievich, I don't have any remarks. Anatoly Grigorievich, I don't have any remarks. Valery Nikolaevich, I don't have any remarks, and I don't have any remarks as well. We can have a technical break before we begin the open voting. Dear colleagues, do we need a technical break? No, I don't think we need a technical break. Please let us make sure that this session of the dissertation is being broadcast. Let us make sure that we can hear each other and see each other. Those who are attending the session online, can you hear us and see us? We're beginning the open voting on the issue of conferring the academic degree to Galina Karaseva, the academic degree of the candidate of medical sciences, scientific specialties 3.1.18 internal disease illnesses, 3.1.9 surgery. Let me remind you that the decision of the Dissertation Council is positive provided more than 50% of the Council members have voted in favor. This is in conformity with Section 23 of the Order. Natalia Alexeyevna, how do you vote? I vote for conferring the academic degree. Viktor Anatolyevich, what's your opinion? I vote in favor of conferring the academic degree. Professor Rumyantsov, what's your opinion? I vote in favor of conferring the academic degree. Professor Baluzek, how do you vote? I vote in favor. Professor Vinnik, how do you vote? I vote in favor. Professor Glukhov, how do you vote? I vote in favor. Professor Kucher, how do you vote? I vote in favor. Professor Minev, how do you vote? I vote in favor. I, Professor Mazurenko, also vote in favor. So, all members of the Dissertation Council who are participating in this session, 9 people have voted in favor. Nobody abstained from voting or voted against. So we award Galina Karaseva with an academic degree of the candidate of medical sciences, scientific specialties 3.1.18 internal illnesses, 3.1.9 surgery. Let me congratulate you. Now I give closing the floor to the academic degree seeker. Dear members of the Dissertation Council, dear colleagues, dear friends, thank you very much for your help. I would like to thank the Dissertation Council who helped me a lot. I would like to thank St. Petersburg State University for giving me an opportunity to defend my dissertation. I would like to thank my research advisors who have been helping me. I would like to thank the AMO company, the company which produced the gas analyzer. We have overcome lots of challenges. I would like to thank those who helped me with the statistical analysis. I would like to thank the person who helped me with receiving the patent. So thank you very much. We congratulate you. This is the end of the Dissertation Council. Thank you very much. Switch off the broadcast.